Hi, everyone. Welcome and thanks for joining us. My name is May. I'm a producer at Be a Hero. Tonight, we're going to be hearing from Laura Packard about the public health insurance option proposed by Democrats in Colorado. This legislation has been the result of years of really hard work and dedication by progressive lawmakers in Colorado, and State Representative Dylan Roberts, the lead sponsor of this bill, along with State Senator Kerry Donovan, have said that among their constituents, when they talk to them, healthcare has been really the number one issue for them. It always comes up again and again, and they really expect the implementation of this bill to not only increase access to care, but to also lower health insurance costs in Colorado.
We're doing this at the state level because there is no action at the federal level. Of course, the Affordable Care Act got passed in 2010, and that did a lot of good things, but it certainly left a lot of gaps. We don't have universal healthcare coverage, and we have people who can't afford healthcare coverage, or even if they do have some level of coverage, it's not adequate coverage. So we are doing this on a state level because Congress is not doing anything, and our constituents are demanding action. It would be great if Congress could do this for us, and then Rep. Judah and I could focus on other things.
So now I'm going to turn things over to Laura. Laura is not only an award-winning digital media and communication strategist, she's a small business owner, founder of Healthcare Voices, which if you haven't checked out, definitely do that. She's a cancer survivor and fearless healthcare activist. And last night, she was actually testifying at the Colorado Senate hearing for this bill, a hearing that we hear lasted a whole 7 hours. So we're incredibly happy to have Laura here today to talk to us a little bit about what transpired, the legislation itself, and what we can do and expect to happen both in Colorado and as a nation. So without further ado, Laura Packard.
Thanks, May. And last night, the hearing in the Colorado Senate Health Committee did last over 7 hours, but that's nothing compared to the hearing a month or so ago in the State House, which was even longer. So it's good that people are talking about this, but this just goes to show how much opposition there is to change, because a lot of people make a lot of money off of the system the way it is currently. Healthcare costs in Colorado are just too high. And Metro Denver, where I live, has some of the highest profits for hospitals in the country. And the insurance companies are doing just fine, too. So Colorado legislators, including Rep. Dylan Roberts and Senator Kerry Donovan, came together and they put forth a bill a year ago to set up a Colorado public option. But the pandemic happened, and so that bill got stalled last year. And so they brought it back again this year. And it's gotten pretty far so far. It has passed the Colorado House. And like I said, last night was the Senate's hearing. So it's still in committee in the Colorado Senate, but hopefully it will be voted out of committee this week and maybe voted on by the full Senate this week or next week. And hopefully it will pass and be signed by the governor into law. So I'm pretty excited about that because I'm a cancer survivor. And to Colorado at the beginning of 2019, and I saw my just here for the first time for a checkup. And so they ran some lab tests and so on. And I got a bill for over $7,000. And my out-of-pocket costs to that bill was over $1,000 for what was essentially a checkup. And that's just one example of the interesting business billing practices of some of the Metro Denver hospitals and how they're really gouging patients like me and maybe like you too. That's why we need more competition. And the Colorado option will do that. It's not really technically correct to call it the Colorado public option now, because the original bill was to set up a governmental entity to have direct competition with the insurance companies. But as it's gone through the legislative sausage making process, the current version would set up a heavily regulated standard benefit plan with the insurance companies administering it. So it is not technically a public option, but it is a lower cost option for people on the individual market. So that would be people that are uninsured or small business owners or employees, and also the small group market. So that could be significant chunks of Colorado, including me as a small business owner. My policy right now is through the ACA exchange and the individual market. So I personally would love to have a less expensive option. And a part of this bill requires the insurance companies to have an 18% reduction in their premium costs over the next 3 years. It doesn't specify how they get there, but just that they have to lower their prices by 18%. And also there would be an insurance ombudsman and rate hearings to look into how and why these insurance costs are so high. So we really need more visibility into these extremely high costs, and we need to lower them for average Coloradans. So the standardized plan that would be offered through the Colorado option would require certain benefits and deductible levels and be regulated by the insurance commissioner, who is appointed by the governor in Colorado. And insurers will have to offer the plan in every county that they operate in. So this wouldn't be a plan just for Metro Denver or Boulder or whatever. This would be a plan offered in every county in the state. So I'm excited about that, especially for parts of Colorado that have really high insurance costs, like the western part of the state, the more rural parts of Colorado that have some of the highest costs in the nation. People really need a more affordable option. And we need to hold the insurers and the big medical systems in check, because right now they're riding roughshod over the rest of us. I personally lost my doctors and medical team this year because my healthcare system, UC Health, didn't contract with any provider on the individual insurance market for Metro Denver. So they cut out thousands of patients in the most populous part of the state for inexplicable reasons. So we really need more competition and more regulation of these insurance companies. And we need to have affordable options so that everybody that doesn't have health insurance right now can get it. So where we're at legislatively is it's gone. The Senate committee was yesterday. Hopefully the Senate committee will vote this week, and in full vote this week or next, like I mentioned before. The Colorado Senate legislature is due to adjourn no later than June 12th, but they are really trying to get done earlier than that. So we'll see. Their original goal would finish up by Memorial in a couple weeks. We'll see if that happens. I don't know if they're really going to make that deadline, but sometime in the next few weeks, Colorado is going to act on this. And that's why, Braden, it's so important to get in touch with your state senators and tell them you want this bill. You want insurance reform. We need to do something about healthcare costs in Colorado. And Colorado isn't the only state. The state of Washington was the first one to pass a public option a year or so ago. And Nevada right now is looking at a public option as well. So if you live in Nevada, pay attention this week and next week, because your state legislature is also finishing up. And there is a public option bill in Nevada that your legislators should hear from you about. So are there any questions so far, May, on the live stream?
We don't have questions from our audience, but I have a question for you. Why should people outside of Colorado also be engaged in, following the news in Colorado?
Well, Washington is the only state in the country right now that has a public option. And President Biden promised a public option nationally. Last year, I had the honor of speaking with him at the Democratic National Convention, and he promised actually to me that he would push for a public option. I think that has been overshadowed with more current events, and we'll see, given the 50-50 nature of the Senate, and it's unclear whether this could go through reconciliation. It's unclear whether it's possible, and it's going to be really hard. But one thing we can do is pass reform in the states to show the nation how it can be done and to encourage other states to move forward, because what starts in the states is often what happens nationally. So people all across the country are suffering from high costs of healthcare, high deductibles, high premiums, high drug costs, and then we can tinker in the states, and hopefully that will generate momentum to have change happen nationally too.
And if you don't mind me asking, but how do you think having something like this enacted while you were experiencing your struggle with cancer or your fight with cancer, how would that have changed your experience?
Well, I think that I would have paid less if I'd had a public option. The goal is to bring down costs for everybody. But this 18% marker would be great to see lower premium costs in Colorado. But also just having more competition, I think, is good for everybody that purchases their healthcare, having more choices. Because right now, with such limited choices, the insurance companies don't have good incentives to behave. And if and until we can get to a point where everybody in this country has guaranteed universal healthcare coverage, we live in the system we got, and people's lives depend on getting this right.
Yeah, that's great to hear. So how can people get involved if they're interested too?
Well, if you live in Colorado, you should go to bit.ly/co-public-option to contact your legislators and tell them you support the Colorado option. And if you live in Nevada, you should go to bit.ly/nv-public-option.
Awesome. Thank you so much for sharing. Is there anything else you wanted to add?
Just pay attention to what's happening in your state. And if you think healthcare costs are too high, which probably everybody watching this believes that, don't just contact your US senators and your congressperson about it. Contact your state legislators and let them know you want change, and they should watch what's happening in Washington and Colorado and Nevada for a way to go forward.
Awesome. Thank you so much, Laura. And thank you all for joining us. I hope you learned a little bit about what's going on in Colorado, and stay tuned to find out more.
Thank you.